Hi, Maria. Why do massages cause flare-ups? So this is an interesting question that I get a lot, and well, I shouldn't say I get that specific question a lot, but I know in fact that it could be something that could happen. So a lot of times when I have people come in with an acute injury or they're in acute pain, and their first thought is I feel like I got to go in there and work the muscles out. And absolutely not. Absolutely not. That's something that you got to be very cautious about because, again, we have to remember that the spine and all of our bones, right, they have muscles that attach to those bones and then they connect to somewhere else, another bone, right? So those muscles, when you're in an acute situation, those muscles are in spasm in theory. So the last thing you want to do is to go and do like a deep tissue massage on a muscle that's in spasm because that muscle is gonna respond in a not so nice way. It's gonna likely spaz even more, and you might get some temporary like feel good feel some relief during the massage, the actual massage. But once you get off and the muscles are kind of calmed down, they're not warmed up anymore. They're likely going to tighten back up, and it's going to come back, with full force. So that's a lot of times when you'll see me suggesting to not get a massage after an acute flare up of some sort. Another thing is, you talked about having the injection, and the one thing you got to remember about injections of any sort is that it is a bit of a band-aid in some cases. So it's taking away a lot of the inflammation, the pain that you might physically be feeling, and kind of masking it, almost like an Advil with a headache, right? So you have to keep that in mind and be cautious of that as well. So one thing that I would maybe suggest is changing the style of massage, and our massage therapists here are very versed in different styles of massages. A lot of times, most people just come in and they think something's going on here. I just got to dig in there, go deep, and that would be that situation where I wouldn't recommend that. In that situation, I'd probably recommend more of like a Swedish relaxation. Even like a sports massage where it's more like soft kneading of the muscle. You're really trying to take that muscle that's in spasm and elongate it slowly and get those muscle fibers to kind of straighten out and relax a little bit. So that's one thing that might be suggested in lieu of going into a deep tissue. So I hope that helps kind of answer that question, If you have any more, send them my way. I'm more than happy to answer them. Talk to you soon.